Hello everyone, I'm Dr. Beecher. Welcome to Tooth Talk Thursdays. I just took a break from a conference that I'm at to present this to you because I think it's of the utmost importance. I'm going to be doing a mini series on pre-existing conditions, and today we're going to speak to you about hypertension, aka high blood pressure, aka liquor pressure. Alright, so first of all, hypertension is the most common non-communicable disease in Jamaica, and it's one of the top 5 in terms of the killers in Jamaica right now. Okay, normal blood pressure, they have changed it. It's now less than 120/80. Some have given 115/75, but everybody's is a little bit different. But as long as it's one below 120/80, it's considered normal. Then you transition from pre-hypertension to stage 1 when you go 120/80 all the way up to 139/89, and then 140/90 is really the stage 2 hypertension that people are most familiar with. And the extreme, or what they call a hypertensive crisis, is at 180/120. So you're wondering, okay, I have pressure, so why do I need to go to the dentist? Well, first of all, there have been several studies which have found links between your blood pressure and gum disease. So people who have gum disease, they have been found to be 49% more likely to have high blood pressure. Also, if you're an established hypertensive patient, your medication is less likely to work if you have gum disease, right, versus a patient that's coming and getting their regular cleanings and they have healthy gums. Alright, so the theory behind everything is that the inflammation in your mouth, remember the mouth is a part of the body, it's like a continuum, it doesn't exist in space. So inflammation in your mouth will affect other areas of your body, such as your blood vessels, your heart, etc. So that's how they have found the link between your hypertension and your heart disease, gum disease and hypertension, and gum disease and heart disease, sorry. Alright, so we scared you into coming to the office, so you made it into the office, so what are we going to do once you have gotten there? Hello, Orlando. Thank you for tuning in. Alright, so the first thing is that we're going to screen you properly. So we're going to ask you a whole bunch of questions. But before we do that, we're going to try and make you a little bit more comfortable. Alright, we know you're scared out of your wits to come to the dentist, so we're going to try and make you a little less scared, right? So maybe some music in the background, or we'd advise you to bring your headphones with your own music if you want. And then, now that we have got you like a sitting duck, we're going to question the heck out of you. So we're going to ask you what medication you're taking. Can you even remember the name of your medication? When last have you taken it? Did the doctor tell you to stop? Or did you decide to stop on your own and drink like a garlic tea? Right? Also, we want to find out if you have any kind of risk factors. Like, are you a smoker? We're going to look and see, are you too overweight? Right? We're going to ask about your diet, because that will affect the health of your teeth and gums as well as your risk for hypertension. Alright? Also, we would find out if you have any other issues, if you've ever had any heart attack, if you're on any blood thinners, if you have ever had any stroke, if you're diabetic. Alright? Also, we're going to take the blood pressure. So after we have questioned the heck out of you, we have you like a sitting duck, you're incredibly nervous, you didn't want to be here in the first place, we're going to check your blood pressure. So we'll check your blood pressure, and if it is okay, then we can proceed. Alright? If it is a little elevated, then it would depend on several factors. Alright, so for me, the absolute cutoff for any dentist, really, 180/110. That's the American Heart Association recommendation. Right? We send it to your doctor immediately because you're at increased risk for heart attack or stroke. For me though, once it's lower than that, I like it to be as close to 140/90 as possible once you're a known hypertensive. Because a lot of times, unless you're really, really medicated, it may not go lower than that. So I will look at things like your age, if you have any other issues, I will look at the procedure you have come to do, because if you've come to do an extraction and your blood pressure is too high, we're just not going to do it, because of course, you know, your anxiety is going to increase as the procedure goes on. So it's just not a good idea. Also, I'll find out if you even remember to take your medication before you came for your visit. That's also important, because if you haven't taken your medication and your blood pressure is sky high, then it's not gonna get much better, as I said. Okay, so let's assume that you've taken your medication, it's within a range that we can work on. Then we would have to decide what anesthetic we're going to use, because some of them may interact badly with the medication you're taking. All right, so we may want to change the anesthetic to decrease the risk of raising your blood pressure. So we've done what we needed to do, and it's time to get you out of the chair. Also, in terms of hypertensive patients, there are a lot of painkillers we may not be able to give you. The group of painkillers called NSAIDs, non-steroidal anti-inflammatory drugs, like your ibuprofen, like your cataflam, to name a few. We really don't want to be giving you those if we can avoid it, because they have the tendency to raise your blood pressure. And also, as a last resort, you have some patients who they're perfect any other time. When they wake up and they take their blood pressure, it's perfect. And as soon as they walk into a doctor's office or a dentist's office, it shoots right through the roof, no matter what they do. Right? I have had a few patients like that. And for those, we have anti-anxiety medications that we may prescribe to help them. Right? But it's really our last resort. I found that many patients respond really well to a gentle touch, and, you know, you're talking them through the procedure, and that helps them get through it a lot. All right, so just to go over in terms of how you can help to manage your blood pressure, of course, first and foremost, seek medical advice. Okay, if it's severe enough, we will give you a referral letter to your doctor, as we said before, for what we call medical clearance. So seek medical advice. Lifestyle changes. Okay, get some exercise, cut that salt out of your diet, get that sugar and that fat out of your diet. We know it's very hard, okay? Also, manage your stress. Extremely hard at a time like this. We're on lockdown. Several people are out of jobs. You just have to try and manage that stress. It's affecting everyone, but as long as you have life, you can go another day. Okay? Also, you want to make sure you're taking your medications according to how the doctor tells you to take them, not according to how you take them because of how it makes you feel. All right? If you're having side effects, the first thing you need to do is tell your doctor. It may mean that they need to change your medication. It may mean that they need to adjust the dosage. All right? But if you don't communicate with your doctor and say, hey, doc, you know, every time I take it, I feel like X, the doctor is not going to know. So you have to tell them if you're having side effects. Right? And the last thing, of course, the regular dental visits. Okay? So we recommend that you get a cleaning twice a year. If you have gum disease, it may have to be more than that. All right? But just for regular maintenance, it's cleanings twice a year, because remember that if you have gum disease, you have a 49% increased risk for hypertension. I hope this was helpful. We have one more day of lockdown, so they say. Fingers crossed. Okay, everybody, take care. Stay safe. Bye.